In this video, we will cover the workflow of an ED physician seeing a patient with appendicitis who later on will be going to OR for surgery and will be sent home on the same day. Our ED physician will be Dr. Cargill, our surgeon will be Dr. Ward, and our anesthetist will be Dr. Whitty. The scenario is that the patient is currently an outpatient in the emergency department presenting with appendicitis. We will be using RVH demo, ED appendicitis. I'll be acting as Dr. Cargill. Dr. Cargill completes the examination of the patient and confirms that the patient has right lower quadrant pain and nausea. Dr. Cargill will now go and place an order. RVH demo ED appendicitis, clicking the order icon. From here, we're going to click the enter. Under the search all, we're going to be using the ED abdominal flank order set. I will now type in ED abdominal. From here, we will order a CVC, a basic metabolic panel, a CT abdomen pelvis width. Under the relevant clinical information, we're typing in RLQ pain. Under the IV solutions, we're going to pick the Ringer's lactate under IV fluid maintenance solutions. Under the medications analgesics, we're picking acetaminophen. Under the antiemetics, we're picking Gravel, 25 milligrams IV every 4 hours PRN. And we're also picking Consult General Surgery. In this case, a reason for exam, right lower quadrant pain. Please note a verbal communication must occur before placing the consult order. Under provider, we're typing in Ward, colon. Has the provider been notified? Yes. We will now click the submit button and enter our PIN. Once the orders are been signed, the emerge nurse can now go ahead and administer the medication. We will close the button now by clicking the close button on the black navigation bar, and it will bring us back to the tracker. I'm going to initiate the documentation on the patient using Dragon. I'll click on the No Document section. From here, I'm going to pick ED report. As you can see, the triage reference has all the information that was done within triage. I'm now going to proceed under the assessment box, and I will use Dragon to dictate. Patient is a 46-year-old female who presented to the ED with right lower quadrant pain and nausea, period. CT and labs were ordered as well, period. A consult to the general surgeon was requested period, suspected appendicitis period. We're going to click the Save button. This will allow me to go back into my report later on to continue my report. For this section, I will now be the surgeon, Dr. Ward. Dr. Ward receives a telephone call from the emergency physician to discuss the consult. Note this is still required. Dr. Ward assesses the patient in Emerge and views the labs and CT. He determines that the patient requires surgery for appendicitis. After seeing the patient, Dr. Ward will now click on the patient's chart by clicking on My Workload under the consults, RVH Demo ED Appendicitis. You are now prompted into the workload section. In here you can see the reason for the consult and who requested the consult, which was Dr. Cargill. From here we're going to click the chart icon located on the black navigation bar, where we will review the labs and diagnostic imaging and any notes that was done within Emerge. You'll notice that the note that was done in Emerge is still in draft status. From here, I'm now going to place an order. I'm going to be clicking the orders icon located on the black navigation bar. We're going to click the Enter tab. Under the Search All field, we're going to type in ANSAF. And we're going to pick the 3 gram IV 1, and we're changing it from 3 to 2. We'll simply click on 3 and enter 2. We will now also enter the Surge Basic Admission Order Set. We're going to click under Search All, type in Surge Basic. From here, I will start putting the order for the prep for the patient for the OR, NPO, vitals every 1 hour, we already have our bolus and our maintenance therapy. The medication section here is still being worked on and will be available during go live. There are also suggested order sets that's located at the bottom. If you are to put in any antiemetic medications, this is where you would proceed and pick the medication that you would like. For now, these are all the orders. We're going to hit the Submit button. enter our PIN. After we've done our submission, the orders now will be processed at the back, and the nurses will be able to administer the drug. Dr. Ward tells the OR, in person or via phone, to book a non-elective case and completes an add-on case paper booking form and send or give it to the OR clerk. Dr. Ward will now start his consult note. Since we are still in the patient's chart, I will now click the document icon on the black navigation bar. I will look for General Surgery Consult. You'll notice here a consult date and time is required. We'll put today and the time. Under the narrative, I will use Dragon to dictate. Patient is a 46-year-old female who presented to the ED with right lower quadrant pain and nausea, period. Patient has no other medical issues and is otherwise healthy, period. Next paragraph. A consult request by the emergency physician, period. After examining the patient, comma, reviewing the CT and lab results, comma, I confirm that the best course of treatment for the patient to receive an appendectomy, period. Next paragraph. Consent obtained for the patient and the patient is awaiting surgery, period. I will now sign off my consult report. Dr. Ward now notifies the ER registration that the patient will be going to surgery. The ER registration clerk will roll the ED account to a surgical daycare account while the patient is in emergency department. I will now be Dr. Cargill and will finish my ED report. I will click on My List Tracker and look for patient RVH demo ED appendicitis. I will click on the draft section. Within the patient header on the right hand side, you can see that the account now has been rolled to a surgical daycare account. I will now click on the assessment section and continue my report. Next paragraph. Patient has been seen by the general surgeon and has decided to perform surgery on the patient, period. The patient will be going to OR and will then be discharged home same day, period. I will now click the sign button to complete my report. For this section, the patient has gone to the OR and had the procedure done. Within the procedure portion, the OR nursing staff could enter verbal orders from the surgeon, where the surgeon has to accept the orders to be processed. In this demo, we will accept the pathology order that was given during the procedure. I will now be Dr. Ward and click on my sign button located on the black navigation bar. From here, you can see the order that was placed during the procedure. I will now hit the submit button to process the order. I'm now going to hit the sign. And the order now has been signed and will now be processed. For this section, we will be the anesthetist now. I will be Dr. Whitty. I'll be opening the WebAcute status board. From here, we will be clicking the rounds patients. Click Show All List and proceed to the surgical cases. From here, we will be clicking on the schedule grid, the one that looks like a calendar. We're going to pick RVH Main OR, apply. And you now see the patient listed on the actual grid. We will now pick the patient and click the Orders button. Under the Current tab, we're going to pick the black chevron and pick Hold Queue. From here, we're going to add a new event. Under the event reason, we're going to pick PACU anesthesia order. From here, we will click Add New. And under the Search All, we're going to type in PACU and pick Post-Op. All the information will be pre-checked already. We will just add morphine 10 milligrams ml. And we're also going to pick Zofran. We will now click the Submit button. The nursing staff will now process the order. Please note, the paper anesthetic record from the operative phase will be scanned back into the patient's chart. For this section, I will be Dr. Ward, who will now place the post-op orders. I'm under My All Patients. I've clicked on the patient RVH demo, ED appendicitis. We're now going to click on the orders icon located at the black navigation bar. And as you can see, we are under the hold queue orders, where you can see the PCU orders that was ordered by Dr. Whitty. We will now click the Add New Event. In here, we're now going to pick Post-Op Orders, Surgical Daycare, Surgeon. Event date as today. Under the Add New, we will now put Day Surgery. And we're picking Day Surgery Post-Op. Once again, all the information will be pre-checked. Under the wound care instruction, we're going to pick this and type in change dressing when soaked. I will now hit the submit button. And the orders are now processed. Dr. Ward will now do his OR report and discharge the patient. So we're under My All Patient again, and we're now going to click the document icon located on the black navigation bar. We will now look for the operative report. We can scroll, or you can type under the search new document. We will now pick the operative report. In here, under the details of procedure, I will use Dragon to start my dictation. And also under the SIR reference area, these are information that has been entered from the SIR side of the house. I will now click on the details of procedure. I will now use Dragon to dictate. She received perioperative ANSAF period. I emptied her bladder prior to the anesthetic period. My abdominal prep laparoscopy. She had a slightly bulky and inflamed looking uterus period. Initially, we could not see the appendix, but it was located retrocecally period. It was somewhat plump, but not particularly inflamed looking period. I do not see any other explanation for her symptoms period. My mesentery divided. All wounds infiltrated with 0.25% Marcaine period. Skin was approximated with interrupted 3-0 monocryl and dressed with steroid strips followed by tegaderm with integrated pad period. I'm now done dictating the procedure. I will now proceed to the discharge plan section. I can also put in under the name of procedure what the name is. I will click here and dictate. Laparoscopic appendectomy. I will now go to the discharge section. In here, we're going to click the prescription portion. As you can see in here, we're prompted to the reconcile section where we can either continue or stop any of the medications that we have given earlier. In this case, we're going to stop them. And now we're going to click Add New. Under the search all, we're going to give acetaminophen with codeine, 300 milligram and 30 milligram tablet codeine. We're picking the 1-tab POBID. We're going to give it 10 tabs. And you noticed here the reason it already pre-populated for you for pain. We're now going to queue and exit. From here, we're going to hit the submit button. We're going to enter our PIN. From here, you can print the home med list so that we can print the script. I'm just going to hit cancel for now. We're now back to our OR report, and I'm going to keep on finishing my actual discharge section. As you notice here, there is a discharge order that's already been placed. As soon as we sign this, it will automatically go to the nursing side. Under the instructions, we can use Dragon or type any of our instruction. In this case, I'm going to type. Now that I have completed my discharge portion, I will now sign the document. Now that I've signed the document, the discharge plan will be triggered where the nursing staff will complete the patient discharge. This ends our workflow. If you have any questions, please feel free to call your Expand support team.